In our last session, I introduced to you Amelia, who talked about how miserable her relationship was with her husband, whose name is Andrew. And she said, "I just wish the pain would stop." I demonstrated to her that there are a number of ways to eliminate the physical pain of our bodies, but they all have significant drawbacks. Cyanide, for example, causes death. Morphine alters our consciousness. And the disorder I described that eliminates pain completely makes us susceptible to burns and to illnesses that normally announce their presence with pain. Now, let's return to talking with Amelia. So, Amelia, you saw some of the problems that can happen when we eliminate pain. What did you learn from that?
Maybe pain isn't all bad.
Right. So, what use could pain have?
Sometimes it can tell us what we need to know.
There's a word for that. For stuff we need to know.
Information?
Bingo. We almost always look at pain as something bad, so we're obsessed with eliminating it. Now, we could keep doing that, or we could see pain for what it is. It's information. Pain tells us that something is wrong, something we need to pay attention to.
But that's physical pain. I'm not having physical pain. I'm hurting emotionally, and I don't see how that could do me any good.
How healthy is your marriage to Andrew?
It's not healthy at all. It's terrible.
How do you know it's not healthy?
It's obvious.
How is it obvious?
Because I'm miserable.
Exactly. You know your marriage is unhealthy because of the pain that you feel in it. Your pain is information that something is wrong with your marriage, that there's something you need to look at, just like the pain of a brain tumor tells you that there is something wrong physically and something you need to look at. If you were not in pain, you wouldn't know that your marriage was falling apart and needing help.
I never would have thought pain could be useful. Never.
Most of us spend our entire lives preoccupied with trying to eliminate our pain. And that seems to make sense. I mean, who likes pain? But the problem is that we put elimination of our pain ahead of finding and eliminating the cause of our pain, which can be far more serious, just as we described in the case of the brain tumor. You and I talked about how there are risks to eliminating physical pain without treating the cause. It's the same with emotional pain. When we're in pain emotionally, the ways we treat it, if we don't address the cause, uniformly cause even more pain.
How?
We'll talk about that in our next session.